We had an opportunity in the ALPINE study to collect some samples from progression in patients on both the Zanubrutinib and Ibrutinib arm. We have approximately 55 to 60 total samples, and those have been subjected to a targeted sequencing panel with a more sensitive panel looking at BTK and PLCG2. And interestingly, the vast majority of patients have not acquired any mutations in BTK or PLCG2. There were only, I believe, 8 total across all the patients. And so that's a little bit surprising compared to prior data. We think that some of it may be because these were early relapsers on the study, compared to those mutations tend to come up at later times. Another possibility is also that these were patients in second line, which is also fewer lines of therapy than we've seen in other studies that have evaluated this. Most of them did have chemoimmunotherapy as their first line therapy, so that's not really a distinguisher. We saw a few other patients who had new acquired driver mutations, which is another possible mechanism of resistance. But overall, I think we're going to need to delve a little deeper into these samples to try and understand the mechanisms of this early progression on ALPINE.